Hello, my name is Sophia Gonzalez, and I will be reviewing the American Association of Colleges of Nursing Essentials, Domain 4, which is the scholarship for the nursing discipline. Domain 4 scholarship for the nursing discipline is a synthesis, translation, application, and dissemination of nursing knowledge to improve health and transform healthcare. The nursing scholarship informs science, enhances clinical practice, influences policy, and impacts the best practice for educating nurses and scholars and leaders. Basically, what this is, it's the delivery of the nursing service with evidence to apply to the nursing discipline in order to solve healthcare problems. Now, one of the competencies of the scholarship of nursing is advance the scholarship of nursing, and part of the subcompetencies that you can see here first is demonstrate an understanding of the different approaches to the scholarly practice. An example that I could think of was when you use evidence-based practice to use oxygen to help a patient with hypoxia, especially those that are like COPD patients, knowing that they have a certain CO2 retaining, so using certain amount of oxygen would not be beneficial for them, but using evidence-based practice to know exactly how much oxygen, when to titrate down, was my example of the first one. 4.1b, demonstrate application of different levels of evidence. An example of this is recognizing family members' influence on a patient's presentation or symptoms and utilizing them to help take care of the patient. Next would be applying theoretical frameworks or models in practice, and the best one that I could think of is like using a team nursing model to run a code during an emergency situation. And then advance the scholarship of nursing continued. We have demonstrate an understanding of basic elements of the research process. I basically thought of a nursing student applying parse, human becoming, gathering information, and writing a paper on how this theory best applies to the art of nursing. Next is the participate in scholarly inquiry as a team member. A nurse giving ongoing education to a participant of a clinical study is what I best thought fit this particular subcompetency. And next, evaluate research. A nursing student comparing different nursing theories and conclude which one they have experienced in a clinical setting. And then there's one more continued, communicate scholarly findings. So my best example of this, I thought of when you're working as a nurse and you have clinical hours that you apply towards an advancement project at work. One that I've seen is some nurses actually observe and collect data on how nurses sanitize hands or wash their hands after stepping out of a patient's room. It's not it's more of like data collection. It's not really like incident report or anything. If they don't or do see a nurse doing this, is just to help use evidence-based practice and help collect data on nurses actually following these evidence-based practice protocols. Okay, now moving on to the next competency, which is to integrate best evidence into nursing practice. First is evaluate clinical practice to generate questions to improve the nursing care. So what came to mind was a nursing instructor reviewing with a nursing student steps of Foley insertion prior to entering a room to perform the skill. So when you go in, it's best to know exactly what steps you're doing so that you are not practicing on the patient, but you already know the skill and you don't compromise the patient's safety by not knowing what steps to take. Next is evaluate appropriateness and strength of the evidence. A nursing professional having a knowledgeable colleague peer review the research article prior to publication. I've heard that this is very common in kind of evaluating whether the information that you are putting out, whether it's like research, just having another fellow colleague peer review, especially one that specializes in the topic that you're writing about, having them review this and validate based on their knowledge and research findings that the information you're putting out is accurate and appropriate. Next is the use best evidence in practice. An example of this is using the latest evidence-based practice information. For example, when you are signing up for CEU courses to fulfill those hour requirements for license renewal. And then some more continued, participate in the implementation of a practice change to improve nursing care. An example of this as a nurse taking on a role of leadership in wound care and being a resource for their fellow nurses on their unit to be able to be kind of like that leader in knowing the latest evidence-based practice in that area. Moving on to the next competency and sub-competencies, promote the ethical conduct of scholarly activities. First is explain the rationale for ethical research guidelines, including institutional review board guidelines. So the best example that I could come up with is gathering data and explaining the appropriateness of the clinical trial as the nurse to the institutional review board. So they are the ones that are in charge of denying or approving or making certain changes to clinical trials that are being done. Next is demonstrate ethical behaviors in scholarly projects, including quality improvement and evidence-based practice initiatives. So an example of this is practicing safe patient information handling and using discretion according to the patient's request when it comes to clinical trials. Next is recognize the impact of equity issues in research. An example of this was nursing students volunteering in the Riverside Free Clinic that serves homeless and other uninsured population of Riverside County. I've actually went to Riverside City College and for my ADN, and we did go and volunteer for these underprivileged people that don't have any health insurance or any medical attention that desperately possibly need it because they have illnesses or comorbidities that have not been managed for years, maybe months. And so overall, the scholarship for the nursing discipline domain competencies and sub-competencies serve as a guideline for the ever-changing nursing discipline. This is done by using the latest evidence-based practice research to support clinical decision making. I basically, when I was reading through these competencies, sub-competencies, I did notice that are like, wow, these are a lot of the things that we either learn in nursing school or we kind of touch up on our nursing jobs. And basically it's kind of this filter of all the information, or even the delivery of how we do certain nursing practices have gone through this scholarship of nursing discipline domain. A weakness that I probably thought about that is for this domain specifically is just like furthering the knowledge of how healthcare inequality can affect nurses leaving the profession. I did see also kind of a correlation of how recently, like the pandemic and nursing shortages, nurses leaving the discipline, how that affects the demand, and then the hospitals, and also the quality of new grad nurses that have been put out, all because of these changing aspects of the nursing discipline and how it all trickles down into how our research of the delivery of the nursing service is changing. And in some parts it could be good, and in some parts it could be also bad, because we're moving into technology and resources, like as far as what saves the most money obviously is what a lot of these companies are looking for. And are we moving away from this kind of ideal that it is that patient nurse relation that we are moving from, and moving towards more of a like skills and not including the patient in our everyday clinical decision making, which it should be. I thank you for listening to this presentation, and that concludes my presentation of the scholarship for the nursing discipline domain, competencies and sub-competencies. Thank you.